Blue Cross Blue Shield says 7,500 Medicare Advantage plan patients will lose their insurance coverage by the end of the year in Montana, and that could leave them possibly out of network at their local hospitals with the options they now have to choose from.
MTN's Augusta McDonald has more on how a group of hospitals are working to keep their community's patients in network.
In October, Blue Cross Blue Shield announced they were withdrawing from the Medicare Advantage plan market in 30 of Montana's rural counties. In many counties, they were the only company selling that product who also had a contract with the local provider. This created an opening in the Medicare Advantage plan market that another insurance company is now trying to fill. Humana is currently selling their Advantage product in rural Montana counties, but some of that is happening in areas where they don't actually have a contract with the local hospital. That leaves patients out of network in their own hometown. A group of hospitals is trying to work with Humana to change that through Monida Healthcare Network, a nonprofit contract negotiating group. Their executive director tells me that group includes 8 rural hospitals statewide: Broadwater Health Center in Townsend, Granite County Medical Center in Phillipsburg, Deer Lodge Medical Center in Deer Lodge, Ruby Valley Hospital in Sheridan, Barrett Hospital and Healthcare in Dillon, Mineral Community Hospital in Superior, and the Clark Fork Valley Hospital in Plains. A hospital in Ronan is also in their group, but BCBS did not withdraw from the Advantage plan market in their county. In order to keep patients who want to stick with an Advantage plan in network and covered by January 1st, Humana and this group had only 3 months to negotiate a contract after BCBS announced their withdrawal.
It's kind of difficult when somebody pulls out of the county like this with this kind of notice. It's difficult to get those contracts in place, and it leaves people kind of scrambling for coverage.
Going out of network at the only local hospital means these senior patients might end up driving long distances for their health care on Montana's roadways. Polson and Missoula are the closest options for people in Mineral and Sanders counties. The CEO of Mineral Community Hospital in Superior says it threatens the health of the hospital.
Possible loss of patients, possible uninsured patients when they do come in. It could have a financial impact on our facility if those patients are going elsewhere, and this hospital is very much needed in this community.
If these hospitals and Humana don't come to an agreement, for some of them there will be 0 in-network Advantage plan options. That leaves older patients driving long distances for their appointments. That's not a great option in the wintertime especially. So the alternative leaves patients switching their insurance coverage back onto regular Medicare to stay in network locally and purchasing supplements in the additional parts, which are for sale in every county by several insurance companies. Those products have better coverage but with a higher premium. So there are options, but these patients are being left with difficult choices. Reporting in Missoula, I'm Augusta McDonald for MTN News.
The only hospital with an Advantage plan right now, an alternative in that group, is in Dillon. They already have a contract with Humana for that